I'm Darrel Mutchler. I work for Averra McKennan in Sioux Falls, South Dakota. When we were looking for a new pharmacy system and we looked at Enterprise, our main priority was to try to get some uniformity among our pharmacies. We had a couple of different pharmacies and we did a lot of different things, and so we had multiple systems, which was quite a challenge to our staff. If they were needing to fill in another area, they were working on maybe a completely different system than they worked on a day-to-day basis. And so Enterprise has allowed us to use the one system in all of our pharmacies, which has really helped us with our staffing of the pharmacies. We've gained many efficiencies with the Enterprise workflow. We now have, of course, the queues to work in, and so we have assigned people to the queues every day with the data entry, adjudication, exception queues, and all the queues. It just allows you to organize your work. So it's eliminated almost 100% of the paper flow through the pharmacy. Some of the initiatives we've implemented since we've switched to EnterpriseRx are technician data entry in the system, which then has freed up our pharmacists to spend more time with the patients, connectivity to our hospital system through HL7 to allow us access to that information and to download it into EnterpriseRx, which again saves the entire staff time with data entry. We have third-party search functionality with EnterpriseRx, which again saves us a lot of time and allows us to have a significant number of outpatient discharge prescriptions ready when the patient arrives at the pharmacy, where prior we would have to then start collecting insurance information, allergy information. So it's really allowed us to provide a more timely service to our patients. Any computer system change is a highly stressful situation for any pharmacy staff. And I think McKesson provided the most organized conversion that many people in our organization had seen. Everyone from my finance department to my IT department said it was the most organized they had ever seen. The on-site support staff on I think it was the first 3 days of conversion, where they were just great to try to bring down that stress level among the staff. And McKesson has an ongoing support team. Our customer advocate, we have conference calls periodically and where we can share any issues or problems we are having, and they really go to bat for us to help us out. Better health for our patients with Averra McKennan means having a more integrated healthcare team, the pharmacists working more closely with the nurses, the doctors, even the third parties on providing these patients not only the medications they need, but the education to use them appropriately, and hopefully save both the payers and patients money in the process. I think the McKesson Enterprise system going forward is going to help us, as accountable care organizations are launched, help us connect with the rest of our healthcare organization to drive patient care, decrease readmission rates, which then all will improve our bottom line. For outpatient pharmacies that are considering using EnterpriseRx, 3 reasons they should seriously consider them would be: one is the HL7 interface with the hospital system. We can find the patient in the hospital system and download all their demographics, saves an incredible amount of time as you're receiving the outpatient scripts. Secondly, it greatly improved our workflow and organization within the pharmacy. And thirdly, we were able to expand our technicians' role into things like data entry because the system's designed for the DUR overrides and to be done at the final stage of the process, and that has freed our pharmacists up then to spend more time with the patient and patient counseling and the things that pharmacists need to do.